Hello, my name is Jenna Yoches, and today I will be presenting a policy analysis on mandatory healthcare coverage in America. This is for the Social Policy Analysis course at Metro State University, Denver. During today's presentation, we'll be focusing on the policy of mandatory healthcare coverage in America while discussing the Affordable Care Act and American Health Care Act, which enforces these policies. We will first begin by discussing the difference between the Affordable Care Act and the American Health Care Act. We will then examine what I consider my micro, meso, and macro life. We will then start the investigation of how the mandatory healthcare coverage policy impacts my meso, macro, and micro levels of my life. To begin, it's important to understand the history of the mandatory healthcare coverage in the United States. Before starting this research, I knew very little about the Affordable Care Act and the mandation of healthcare coverage, but since this policy affects all Americans, it's important to understand it to its fullest. The requirement that all Americans must have health care coverage was first enforced in March 2010 under the Obama administration. It was under the Affordable Care Act, or Obamacare as some people know it as. It was designed as a way to extend health care coverage to Americans. Additionally, the Affordable Care Act brought with it an expansion on Medicaid coverage and was supposed to help lower the cost of insurance as well as allow people with pre-existing conditions the opportunity and access to healthcare coverage. With this act came a rise in taxes. Also, in order to enforce Americans to gain healthcare coverage, there was a tax penalty for not having coverage. This policy came out of the beliefs that all people deserve quality healthcare. In March 2017, the Affordable Care Act was repealed and replaced by the American Health Care Act under the Trump administration. In May of 2017, the repeal was passed and came with it many policy and procedure changes. I was personally not aware of this change until I started this research. I knew when President Trump was elected that there were attempts to repeal the Affordable Care Act, but I wasn't aware that this actually went into place, and I wasn't aware of the changes. Understanding this and how quickly changes in policy occur helped me understand how these changes affect my life and how they'll affect my future client and my community. There were many changes from the Affordable Care Act to the American Health Care Act, not only in the name, but in the types of policies and procedures. These are just a few of the changes that I believe will affect my social welfare levels the most. According to this act, by 2020, all tax credits will no longer be income-based, meaning in all states in America, there will just be a flat rate for people that is adjusted with age. So the younger you are, the less tax credit you get, and you get more as you get older. Additionally, the late enrollment penalty moved from being a taxable penalty to a surplus charge of up to 30% for each month you are not enrolled in a health care program. Addiction services are also no longer required to be provided for individuals with Medicaid, meaning that Medicaid can no longer provide addiction services. Additionally, federal funding for Planned Parenthood was suspended for 1 year. I'm not discussing this in this presentation, but I thought that this was an interesting change, especially since that year was over with in May. And I haven't heard if this has continued, if there's federal funding being given back to Planned Parenthood. So that's just something that I'm going to keep my eye out now that I'm aware of these policy changes. There was also a reduction on coverage to Medicaid and Medicare programs. So there was less funding being sent to these programs, which also affects the eligibility. If there's not as much money going to those programs, they can't give services to as many people. Also, pre-existing conditions were no longer determined by the government, and they are now determined by insurance agencies. So each insurance agency will decide what a pre-existing condition is and if they will accept that for their health insurance. To start the investigation on the policy effects, it's important to understand the social welfare levels in my life. At my macro or individual level, there's myself, my family, my partner, my dog, my sister, and my mom. At the meso level is my community, which consists of Colorado. This will be the aspect that I will be investigating the effects of the policy on during this presentation, but it's good to note that I also am involved in the Parker, Colorado community and the Metro State community. At the macro level, I decided to focus this presentation on the United States and how the policy of required healthcare affects that macro level institute. To begin the investigation of insurance mandation, it's important to look at my macro level life, meaning my family and myself. That's my macro level social welfare. Some of the positives of this policy for myself is that I will continue to have access to healthcare because I'm mandated to have healthcare or I have to pay a penalty. I should have better health. In theory, I should be going to the doctor more often, receiving medications that I need. Having insurance encourages people to go and get access from or get help from doctors. Additionally, I'm allowed to stay on my parents' health insurance until I'm 26 years of age. Without this, it was different for each insurance agency on how old a child can be in order to stay on a healthcare plan. Currently, I'm not on my parents' healthcare coverage, partially because it's super expensive and partially because I'm a college student and I can't afford my private insurance, so I use the student health care. This makes me feel like I don't have a say in my healthcare policy, which is unfortunate. But to go back to access to healthcare, I don't believe without this mandation that I would currently have health insurance. Because it's expensive, because it's difficult for me to get on my parents, I'm not sure if there wasn't this policy in America, I would have health insurance right now. Some of the cons have recently developed over my lifetime. When the Affordable Care Act was first created, I don't believe there was as many negative factors for me, partially to do with the policy change, but also to do with changes within my family's life. Recently, my father became unemployed, and the policy of him needing to have insurance has made it difficult for him to find insurance that is cost effective. He could get on his wife's plan, but it's quite costly to add members to, and he's not eligible for Medicaid. So he's looking at paying the penalty this year for not having health insurance. Another recent development in my macro level life is that my mother was diagnosed with fibromyalgia, and with career changes and company changes, she's had to search for different healthcare coverage, and her pre-existing condition has made it really hard for her to find this. She's been denied coverage from several different agencies, and it also makes her healthcare coverage quite costly. While recent developments have made the policy of healthcare coverage more important in my life, I believe that the largest change that this policy has and the most effect it has is in the meso and macro levels of my social welfare levels. For my meso, I will be focusing on Colorado, although I am a part of Parker, Colorado's community and Metro State. I believe that there's more impact on the community of Colorado to this policy, so that's what we'll be investigating. When discussing the policy effects on my meso life and the community of Colorado, it's important to understand who I am talking about, who's in the community. Around 70% of people in Colorado identify as white. Around 25% identify as another race or mixed races. This is primarily the Hispanic and Latino community in Colorado who identify this way. So 25% of Colorado's population is Latino or Hispanic, and this is the largest population that I believe will be affected by the policy of mandated insurance in Colorado. Although all Coloradans are affected by the policy of mandated health insurance, I believe that the largest group that's affected from the new policy changes of the change from the Affordable Care Act to the American Health Care Act would be the Latino community, which is 25% of Colorado's population. I believe that they're the most affected by this policy change because in 2016, there was the lowest rate of uninsured Latino adults at 25%. In previous years, there was 40% of Latino adults that were uninsured. Additionally, in June of 2017, so right after there was the change from the Affordable Care Act to the American Health Care Act, the census came out that there was the lowest rates of uninsured Latino children in the history of Colorado. With the changes from the American Health Care Act, I believe this group will be affected because the American Health Care Act hasn't planned to reduce funding towards Medicaid and Medicare services. 52% of people in Colorado with Medicaid services identify as Latino. This is over 400,000 people with Medicaid coverage in Colorado. When Medicaid and Medicare services are reduced, this group of population might stop seeking insurance, meaning that they might not have access to health care. And although I focused on this community in Colorado, I believe that this will have an effect on anybody who has Medicaid in Colorado, and to the children of these families. The reason why I focused on the Latino community in Colorado is because the Latino community, along with the American Indian and Alaska Natives and African Americans in Colorado, have the highest percentage of people using Medicaid services. So when these services are cut, as I previously stated, these are the groups that are going to be largely affected. And because such a large percent of Colorado's population identify as Hispanic or Latino, these changes will surely affect this population. According to the Kaiser Foundation in 2014, 35% of the Latino population in America had Medicaid. The Latino population also had some of the highest percentage of people without insurance. This also although the changes also affect Colorado Latinos, this greatly affects America Latino population as well. And something important to note is that the minorities have the lowest rate of employer insurance coverage. So minorities in America have more use and are more marginalized when Medicaid services are cut. They also are the population with the highest percentage of uninsured people in America. So when these coverages are starting to be cut, these populations are going to be the first to be affected because there are less people insured and because there are more people that identify as Latino, Hispanic, Black, or these other minorities use Medicaid the most, and that's how they gain their healthcare coverage. With these policy changes, we are seeing how the policy of Americans needing to have health insurance are affecting minorities and marginalizing them because they are the ones with the least access to them. To conclude our investigation on the policy of required healthcare in America, we will now finish with the macro level social welfare. Instead of focusing on one group, I will be focusing on all of America and how this policy affects everyone. The policy of required health insurance in America affects all of its citizens. With the Affordable Care Act, there was a larger access to health care. Because Americans were incentivized by having healthcare or paying a penalty, more people were seeking healthcare coverage. In theory, this would mean that more people would be going to the doctor and taking advantage of health services, as well as getting medication that they needed. This allowed healthcare to be more affordable, but there was an increase in taxes to pay for this. There was also an increase in premiums that people had to pay on their insurance. Another negative side effect that was saw with the Affordable Care Act was that many businesses began to cut hours to avoid paying individuals or to avoid covering individuals' health coverage. So they would cut people's hours from 40% to 30% just so that they didn't have to offer them health care. With the American Health Care Act, we are seeing changes in refundable tax credits, limited access to addiction services, limited funds to Medicaid and Medicare services, meaning that there's limited eligibilities for these programs as well. And insurance companies now have the right to determine pre-existing conditions. Although more Americans have health insurance now more than ever, with the changes from the Affordable Care Act to the American Health Care Act, we might be seeing more or maybe less people with health insurance. It's my understanding that the Trump administration's plans to dismantle anything that resembled the Affordable Care Act. So we might see more policy changes in our future, and we might see more changes to our macro or my macro level social welfare. In conclusion, the policy for required healthcare coverage in America affects many aspects of my life, not only personally, but in my community of Colorado and in America. Understanding how healthcare coverage affects you and your community is important. Although you might not be affected by a policy currently, changes throughout your life or changes to that policy might affect how the policy treats you in the future. This may also affect how your clients and potential clients may be affected. So for me, I have an interest in working with at-risk youth, so understanding how the changes in policy might affect them may be super important for me in the future. I may have to adjust my insurance to allow different, and my policies in my practice to allow different insurances. One of the most interesting things that I found throughout this investigation was how laws and acts change policies. Additionally, we learned in our textbook, The Policy-Based Profession, An Introduction to Social Welfare Policy Analysis for Social Workers, we learned that policy is shaped by value. So when a policy is first enacted, the values that go into it shape who it's going to affect, how it's going to affect, the laws that are enforcing this, and the acts that are made from the policies. We are seeing in real time a policy change that affects the larger part of America. We moved from the Affordable Care Act to the American Health Care Act, and watching that in real life is really showing how values change policies, change acts, and change laws. There might be more repeals to the American Health Care Act in the future, and one of the things that I said early on was that I was unaware that there were changes to the Affordable Health Care Act. Although I knew that they were coming, I had no idea that they were actually put in place, and I had no idea what the changes were. This taught me that I should be more aware in policies, investigate them more, and stay up to date with them, not only for myself, but for my family and my potential clients. This has been my presentation on required healthcare policy in America.